I want to start off just by saying that this morning, Maria and I participated in and really just attended the 3 Stars of Tennessee event, which is an event that honors and recognizes and interacts with the families of those Tennesseans who lost their lives this year in the line of duty. Firefighters, law enforcement, first responders. And this week, in fact, is the week that we remember and commemorate the September 11th tragedy. It is important, I think. Well, what happened this morning, what happens all across this country, it's important to take time to remember, and we do so as a nation. And my hope is that God will be near to the brokenhearted throughout this week as they remember the losses of their own families, however those losses occurred to them. We did a lot of travel this week through our 225 stops. We were in Van Buren and Hamilton and Meigs and multiple counties, Perry, across the state. While we were in Meigs County, I will mention that they are a rural county. They have the highest vaccination rate in the state. We commended them on that vaccination rate. We've actually got a number of rural counties that are, Van Buren, for example, that has a rapidly increasing vaccination rate. So while we remind Tennesseans the most important tool that we have to fight the pandemic is the vaccine, we want to encourage and show gratitude for those counties and those leaders that are leading the way in vaccine. Dr. Pierce, you want to come up and make a few comments, and then we'll take questions.
Thank you, Governor. Good afternoon, everyone. A couple of brief updates. Our hospital capacity concerns are relatively unchanged from last week. Not a lot better, fortunately not a lot worse. The primary strain in our hospitals is in ICUs. 55% of all of our ICU beds statewide, are filled with COVID patients. 7 out of our 8 healthcare coalition regions are using their surge plans. They are essentially at their ICU capacity. The important thing to remember is that almost all patients in the ICU, about 95% of patients in the ICU, and almost 100% of patients on ventilators are unvaccinated. We know that our vaccines are very safe and very effective, particularly against severe disease. I want to talk a little bit today about third doses. Let me tell you what third doses are and what they are not. A lot of people use the term third doses and boosters interchangeably. They are not the same thing. I realize there's been some confusion on the timing and the rollout of third doses and boosters specifically, and we anticipate the President giving some updates in the next hour or so to clarify some of the plans related to booster doses. I want to remind you, booster doses are currently not approved and are not approved to be given in this state because the FDA has not yet authorized that. However, that's different than a third dose. So third doses provide additional immunity to people who may not have built up as much of an immune response with the first 2 doses, either because they have a medical condition or because they're on some medication for some type of condition that causes their immune system not to be as strong as others. So let's talk about the people who need a third dose. And I want to back up and tell you why that this is important. You know how I said about 5% of those who are in the ICU and a handful of those who are on the ventilators are vaccinated? The majority of those are immunocompromised people. So it's important for people who have weaker immune systems to get this third dose to complete what we call their primary series. So here are the people that qualify for a third dose. First of all, you have to have already had 2 doses of an mRNA product. That's Pfizer or Moderna. And you get your third dose at least 28 days after the second dose. It's recommended to get the same product that you had the first 2 doses, but in worst case scenario, it's okay if you have to cross over. Those who qualify are those in active cancer treatment, transplant recipients, those that have immunodeficiencies, they're rare, but you know if you have one, those with advanced or untreated HIV infection. And then the one that is probably most widely applicable to Tennesseans is those on chronic steroid therapy or other types of medication that suppress your immune system because it's treating another condition. So with any of those, it's really important to coordinate with your doctor and talk to that medical professional that is treating your condition and talk about a third dose. And then when you're ready, just show up at any of our sites statewide, tell them you're there for a third dose. You do not have to produce any kind of documentation or prescription. You just go and tell them you're immunocompromised and get your third dose then. Thanks.
Thank you, Dr. Piercy. And we remind folks as well that monoclonal antibodies are a very important treatment all across the state, widely available. We are working to improve and increase even that availability, but we want to say that every chance we get so that when people do contract the virus, they talk to their provider about the possibility of monoclonal antibodies. Let's get started with questions. Sir, do you have one?
Yeah, I do. So, Governor Lee, earlier this week you had a photo availability with kids where you did not wear a mask and they were not old enough to be eligible for the mask or for a vaccine. Any response to that? Why you did that?
Are you talking about in Perry County?
Yeah, the Samaritans.
Yeah. So I'm vaccinated, and I'm going to act like that. And if you're asking whether I was concerned about those kids, we actually went to a rural distress county. I washed the feet of elementary children, removed their old socks and their old shoes, put new socks on them and new shoes, and did that for, I believe 700 children were served that day. I'm vaccinated and I felt appropriately safe to do that. I care deeply about those kids and that's why we were there. Yes, sir, you have a question? Gerald.
I have a question for Dr. Piercy really quickly because I have a question for you, Governor. Dr. Piercy, if you're vaccinated, can you spread COVID-19? If you're vaccinated, can you spread COVID?
Yes, vaccinated people can transmit the disease, particularly in the first couple of days of illness, if they have the illness. We do know that vaccinated people, their viral load goes down quicker, and so they typically don't spread it as much, but the answer to your question is yes.
Vaccinated people can get unvaccinated people or children.
If they are infected, yes.
Governor, it's been a week since you, well, a couple of weeks since you announced your plan and how you want to tackle this research of COVID-19. Since we last met, more teachers have died, students have gotten sick, kids have been told not to come to school because of big illness and close contact. What can you point to say that your plan is working?
First of all, to anyone who's died, you made reference to teachers that have died. As I said at the beginning of these comments, our hearts go out to anybody. It's tragic when we lose anybody for any reason in this state. There have been thousands of people in Tennessee and hundreds of thousands across the state that have died as a result of a global pandemic. That's the reason that we're doing the work that we're doing. That's the reason that we met this morning, our unified command group. That's the reason that we're reaching out to schools to work with them on how it is they manage cases. It's the reason we increase funding for healthcare facilities and expanded flexibility for hospitals. What we're doing is working really hard every single day to manage a global pandemic that has moved through states and is residing in a big way in Tennessee right now. We'll continue to do that.
Hey, Governor, I spoke with a grandparent of a child whose teacher died. They were not notified if there were close contact. They didn't know that their child didn't have a teacher. Governor, how is that acceptable that you're not notifying 25 to 30 elementary school students that their teacher is sick with COVID-19?
Yeah, I think the districts make decisions individually about their coordination with health departments and how those are made. I can't speak to a particular decision or a notification, a certain child's situation. I don't know about that particular case, but I know that districts are working with our health departments to make sure that appropriate notifications are made.
And if I could follow up, that is the job of the Tennessee Department of Health. They weren't notified of their teacher at COVID-19.
Yeah, I can't speak to that. I can't speak to that. I can't speak to that particular situation. I'm not familiar with it. But Dr. Pierce, if you know anything about that, no, we don't. Stella.
Hi, Heather. So, the DCS, it was required the DCS is continuing to answer questions about how many children in DCS custody have been vaccinated. As cases surge in schools and more children are hospitalized by COVID-19, are you concerned that the DCS is not releasing that information?
Are you talking about children that are in foster care?
Under DCS,
Yeah. So, well, under custody of the state, but under foster care. I'm not familiar with the data you're talking about. I certainly can get that information for you as to the reasons, but I would suspect that medical information about kids is connected to their foster care parents, but I can clarify that for you.
and also sort of following up on the question you just asked. So it is known that vaccinated people also have a risk of transmitting the virus. So when you met with the children after this, were you concerned
Yeah.
that you might have spread the virus to them, or is that not?
Yeah, I was most concerned about those children and their situation and the ability for us to get them the shoes that they needed. And that's why we were there. Yes, yes, go ahead. Okay.
So next week, the Joint Committee is going to discuss the issue on bail reform. And so does that fit into your agenda, justice reform, or what do you have?
Yeah, I haven't seen any, of course, there haven't been any recommendations from them, so I'll be very interested to know what that joint committee's recommendations are, and we'll take a look at those when they make them. Thank you.
President Biden just announced that he will be mandating employers with more than 100 employees to get vaccinated or take weekly virus tests. How do you plan to handle that in Tennessee?
Well, I think it's a terrible idea. I have not seen that announcement yet. I was preparing for this one, but we'll see the details of that. I think it,
Figure comment for individual choice, business choice.
right. That's why I think it's a terrible idea.
Would you encourage employers not to comply with that?
Well, I'm always going to encourage anyone to comply with the law. I think that would be a very ill-advised law, and I suspect that we'll see a lot of response to that. I think it's a bad idea.
Just
So,
one more question for you. I know a few months ago there were some viral videos involving Karens at a Williamson County meeting with masks. We had another one this week with Rutherford County Karens. Do you condone this behavior with people acting out at these meetings?
what I am most interested in is the health and well-being of the kids, and the parents' input in that's really important. So I'm interested in parents making decisions about their children's health. What happens at a school board meeting is not that's not in my control. Sam?
Hey, Governor Michael.
Michael?
I want to ask a question from the NBC affiliate in Knoxville. I understand that let's just ask this. I understand you received a letter from the school board in Knox County. They were concerned about extracurricular activities. They were hoping that they would be able to have extracurricular activities when they were remote learning. Your response to that letter, have you read it, and what's your thoughts?
Well, there's a very clear process for waivers for schools with regard to quarantine, and they can receive a waiver, and there are very clear rules around that waiver. They've known that. They know that's if they accept a waiver, those things that go along with that waiver, including extracurricular activities, are part of that. So that's a school board decision, and they know that decision is coming when they make it. Any more?
I have a question for you on local versus state authority.
On what?
On local versus state authority, on several different issues, your administration has really defended local authority to make decisions about issues that are impacting the community. Right now, the Nashville entertainment industry is not able to be regulated by local officials because of a state rule that governs certain vehicles can be, certain vehicles can't. Would you support
You know, it would really depend on the particulars of that legislation. There are times when local decision-making is the best way forward in a decision, and there are times when the state has to intervene on behalf of all the people in the state when a local decision might impact statewide. So really hard to answer that without knowing the particulars of the legislation brought forward, but I would certainly be willing to look at it.
Governor, I do have a question.
Yeah, okay. It's all right.
Commissioner Schwinn had said that there would be a dashboard reinstated on school COVID data after Labor Day. Do you know what the status of that is and when it might come up? And in addition, do you know how many students and staff currently have cases? How many schools, have had to cancel at this point?
Yeah. Unfortunately, I don't have that data personally. We have that data. Commissioner Schwint's not here today, but that specific data we can certainly get to you.
And from a broader perspective, everyone has sort of talked about the severity of the outbreak currently. How and when do you anticipate, in your view, your plan working and sort of curbing the spike, given that you said you're going to stay the course?
Yeah. Well, we hope that as we've seen in a string of states for which the virus, the Delta variant, has moved through, from Missouri to Arkansas to Louisiana to Mississippi to Alabama to Florida, and now in Tennessee, Kentucky, North Carolina, we have seen in every other of those previous states a rise in cases, a plateauing, and a fall down. We had a 7% increase this week in case over case counts, which is a significant decrease in the increase. In other words, we're beginning to see what we think and hope, cautiously optimistic, we're hopeful is a plateau. We do not know. Sometimes that happens, sometimes it spikes back up, but we are hopeful that we're at that point in the state. And if so, we'll begin to see the effects of that. In the meanwhile, we are doing everything we can, and we'll continue to press forward with any effort we can make to mitigate the spread of it. Thank you. Appreciate y'all. Thank you.